Good afternoon. Welcome to Apollo Hospitals of Bangalore. A safe healthcare worker will correlate to a safe patient in an institution. It cannot be much more true to the current context of COVID crisis we are going through. September 17th is celebrated as a World Patient Safety Day. The World Health Organization has endorsed this day as Patient Safety Day. In the current environment, patient takes the utmost priority. Every healthcare worker in the system has to be safe to lead to a safe patient care. It is the bottom-up approach we have to take. The safety starts from the cleaner, the porter, the radiographer, the technician, the pharmacist, the nurse, the doctor, literally every person who comes across a patient in the hospital. Certainly, safety measures are of paramount importance for the patient. So, as a surgeon, I have seen enormous amount of change in the processes, change in the guidelines, change in the practice parameters in the last 6 months or so. If anything, I think hospital is probably the safest place in the current context given the safety parameters that have been placed in. When a patient walks into the hospital, you've got awareness campaigns, brochures, flexboards talking about safety measures. A clinical screen is undertaken both using, clinicians, nurses, pharmacists, healthcare workers, in addition to technology. Everybody is screened clinically for presence of temperature, presence of warning symptoms, following which they undergo investigations if there is a suspicion. A fever clinic which takes care of every suspected case. Use of adjuncts for safety, whether it's to do with gloves, masks, face shields, and even hand hygiene. All these are taken as of utmost priority and of utmost importance. Clinically dedicated areas for suspected patients have been organized. In theaters or in interventional suites, whether it's cardiology, whether it's endoscopy, whether it's operating theaters, PPEs are taken as of utmost importance. Patients are screened for clinical symptoms. Investigations are undertaken, including, the rapid test, the antigen test, and even antibody measures are all being done. The whole spectrum of investigations have been undertaken for COVID patients or suspected COVID patients, or even for normal patients who are going to theaters. We are making sure that they do not have a COVID carrier state. In summary, we are in a situation, there is no runaway from it. COVID-19 is here to stay for some more time, but safety has to be the priority here. And safety is the mantra here for every healthcare worker that comes across the patient for a better patient safety. We here at Apollo Hospitals, as a group, have put this into practice, and I don't think we actually lack that standard of care that we provide in terms of the safety, and we are comparable to any of the best institutions in the world. In summary, I think safety is a priority. It is of paramount importance, and on the context of World Patient Safety Day, let us take this oath to say a safe healthcare worker leads to a safe patient, and let us all do our best. Thank you.